Thanks, Senator. Senator Grassley.
Two statements before I ask a couple questions. One is it's kind of a welcome relief to have somebody of your profession in this very important role, particularly knowing the importance of the doctor-patient relationship, because in my dealing with CMS and HHS over a long period of time, I think that the bureaucracy has been short of a lot of that hands-on information that people ought to have. And secondly, when you were in my office, we discussed the necessity of your responding to congressional inquiries, and you very definitely said you would. I, tongue-in-cheek, said maybe you ought to say maybe, because a lot of times they don't do it, but since you said you would, I will hold you to that and appreciate anything you can do to help us do our oversight. As a result of oversight, I got legislation passed a few years ago called the Physicians Payment Sunshine Act. And the only reason I bring this up is because it took Senator Wyden and me last December working hard to stop the House of Representatives from gutting that legislation in the Cures Act that passed. And I want to make very clear that the legislation I'm talking about doesn't prohibit anything. It only has reporting requirements because it makes it very, very, well, it brings about the principle of transparency, brings accountability. And I've got some studies here that we did and some newspaper reports on them, particularly one about a psychiatrist at Emory University that was not reporting everything that they should report. And even the president of the Emory University came to my office and said, thank you for making us aware of this stuff. I want to put those in the record. But since you're administering this legislation, and since Senator Blumenthal and I will think about expanding this legislation to include nurse practitioners and physicians' assistants, I hope that I could get your commitment that you will enforce this act the way it was intended to be enforced, because even under the Obama administration, after we got it passed, it was 3 years getting this regulations to get it carried out. So effectively, it's only been working for about 2 or maybe 2.5 years. So I would like to, if you're confirmed, would you and the Department of Health and Human Services work with me to ensure that this transparency initiative is not weakened?
We look forward to working with you, sir. I think transparency in this area and so many others is vital. Again, not just in outcomes or in pricing, but in so many areas, so that patients are able to understand what's going on in the healthcare system.
Thank you. Now, last one deals with vaccine safety. You're a physician. I believe you would agree that immunization is very important for modern medicine, and that we've been able to get rid of smallpox way back in '77, worldwide polio, I think in 1991, at least in the Western Hemisphere, and all that. So as a physician, would you recommend that families follow the recommended vaccine schedule that has been established by experts and is constantly reviewed?
I think that science and healthcare has identified a very important aspect of public health, and that is the role of vaccinations.
Thank you very much.